Paul Seegert, managing partner at PCS Advisers, joins us now. Paul, how bad could this get?
Well, it's already getting pretty bad in certain parts of the country. We have hospitals, and these things always tend to hit rural hospitals and rural healthcare more. We are seeing that already. We were, even before the pandemic, they had trouble, and now we're seeing that some of them are having to discontinue some of their services because they don't have the staff to do it. Example, in upstate New York, a hospital that's no longer doing labor and delivery, and they're the only hospital within a reasonable drive, I think the only hospital in that county. And there are others that are having to take these similar kinds of steps because they don't have the staff to have the full facility, the full services.
And Paul, to your point, I heard of a rural Texas hospital last week just shutting down operations because they don't have enough staff to staff the hospital. So, this is, a real world implication at this point. How much of what's happening here, based upon your analysis, is really the threat of the Biden vaccine mandate being used by employers who wanted to mandate it anyway?
Yeah, we had a lot of hospital CEOs, especially in the more rural areas, that were telling us they were very hesitant to put a mandate in place, even though they might believe in the vaccine, because of the outcome that we're seeing now, where they wouldn't be able to staff their facilities. But now they have the cover of the fact that it's not them requiring it, it's the government. And so they're taking this step. And then there's complications involved. Their mandate says get vaccinated or submit to weekly testing. Who's going to pay for the testing? These are often already cash-strapped facilities. So, and it's unlikely that as this law or ruling gets interpreted, that they're going to allow employers to shift that cost to employees. And I think some of that may be by design, so that employers would simply say, look, we can't fund the weekly testing, so you either have to get vaccinated or find another place to work.
Do you have any particular advice at this point for employees who find themselves in this situation? They were adamant about not getting vaccinated, but they could be in the crosshairs here? Well,
there are exemptions. Now, healthcare is a tough one. Some employers, non-healthcare employers, are interpreting the ruling to say that if you're a remote worker, it doesn't apply to you because you're not coming into the office and being around the other workers. So oftentimes what we're going to see is these healthcare workers that don't want to get vaccinated are going to transition to other industries, which is going to worsen this staffing shortage that preexisted the pandemic. So there's that option. They also can get a religious exemption. But the challenge with that we're seeing is that some employers, United, you mentioned they're laying off 593 or firing 593 workers today. Even more amazing to me is that the 2,000 people that got an exemption, applied for and got an exemption from that employer, were supposed to be put on unpaid leave, so essentially fired as of 10/1. So they have an exemption, but then they're making the exemption kind of a de facto firing. So that's in the courts. It's been pushed out to 10/15, and we'll see how it plays out.
Well, Paul, thank you very much for the information, the analysis. Paul Seegert, managing partner, PCS Advisers. We'll be